Dear viewers, a warm welcome to educational video series of Sarvodaya College of Nursing. Myself, Professor Priscilla. Let us have another informative video from OBG department. January is Cervical Cancer Awareness Month. On this Cervical Cancer Awareness Month, the messages are clear. Get informed, get screened, get vaccinated. Get informed, find out the fact about cervical cancer and the human papilloma virus that causes it. Educate women in your life too. Get screened. Cervical cancer screening typically starts at age of 30 and is repeated periodically. Get vaccinated. The HPV vaccine is given in 2 doses that should begin when a girl is between 9 and 15 years old. Cervical cancer is a disease in which cancer cells arise in the cervix, which connects the uterus to the vagina. Human papilloma virus is almost always the cause of cervical cancer, which is why vaccines against the virus are an important part of cervical cancer prevention strategies. Increasing screening and prevention are key components of the effort to eradicate cervical cancer. Human papilloma virus is the most common viral infection of the reproductive tract. Most sexually active women and men will be infected at some point in their life, and some may be repeatedly infected. Human papilloma virus is sexually transmitted, but penetrative sex is not required for transmission. Skin-to-skin contact is a well-recognized mode of transmission. Now let us have brief information about the vaccination. HPV vaccine approved by the US Food and Drug Administration before 15 years 2 dosage. The second dose of HPV vaccine should be given 6 to 12 months after the first dose. Adolescents who receive 2 doses less than 5 months apart will require a third dose of HPV vaccine. After 15 years, 3 doses, the recommended 3 doses schedule is 0, 1, 2 and 6 months. 3 doses are recommended for immunocompromised person aged between 9 through 26 years. The vaccine is highly recommended for all women till age 26, especially if they are not properly vaccinated against HPV earlier. Experts feel that it is extremely effective when administered before the first sexual intercourse. While the human papilloma virus is more prevalent in developing countries rather than in developed countries, the other risk factors associated with the disease are wide and various. By creating awareness at the individual and community levels and with proper governmental intervention, the cervical cancer menace can be effectively controlled. It takes governments, NGOs and other concerned organizations to come together to fight against HPV and cervical cancer. So during this month and beyond, let us work together to build back healthier communities by improving access to HPV vaccination, screening, treatment for cervical, pre-cancer and management of cervical cancer by 2030. And end cervical cancer within a few generations. Hope this video will be helpful for the younger generations. Thank you.